Hey guys, Andy Austin, 19 years as a nurse practitioner in interventional pain management. And today we're going to do something different. We're going to talk about the top 4 epic fails of urine drug screens and the reasons that they are given, some of the methods they try to get around a urine drug screen. So stay tuned and we're going to talk about all of them. Urine drug screens are just part of the job. It's a necessary part of the job when you're dealing with people with chronic pain. It serves purposes such as maintaining that the patient's taking the medication the way they're supposed to, and also that the patient is metabolizing the medication appropriately. Sometimes people don't metabolize pain medicine the way they should, and they don't get the analgesic effect. So urine drug screens are important from a medical and legal standpoint. They're everywhere for employers. Everyone requires urine drug screens these days, and we're going to go over the top 4 epic fails. Okay, so when we talk about urine drug screens, there's actually 2 different types of urine drug screens. You have a qualitative, that's the more lower end, it's more of a positive, negative. They're basically just testing for the presence of the pain medication. And we're going to talk about just pretty much pain medication and illegal drug presence in this video. The second type of urine drug screen is the more specific, it's the quantitative. That's the gold standard, okay? And we use that exclusively because not only can we detect the actual parent drug, but also the metabolite, the way the body breaks down the parent drug in the metabolite. And it gives us a good verifiable number shown up in the sample. And it's usually in the parts and nanograms per milliliter, which is a nanogram is 1 billionth of a gram. That's 1 with 9 zeros. So if it's not in there, it ain't in there. And if it's in there, it's going to be in there. But then we use that and we talk with the patient and see if their story matches what the labs show. And it's part of working together. So 4 epic fails. Number 4. And then we also assigned a level of difficulty on all of them. 4 out of 4 is like very believable, okay? And 0 is nothing, okay? So the number 4 is they submit a urine drug screen, random urine drug screen. They come back, the results are everything's negative, okay? Usually that is a very lazy attempt at trying to get around a urine drug screen. And for that, we give the patient a frowny face. But what happens is someone is doing something they're not supposed to, and they just want to provide a contaminated sample, which is usually tap water. We know that very quickly. The urine drug screens have a temperature gauge. They sometimes try to put it under their arm to warm it up. It doesn't work. It doesn't work. Sorry. The creatinine level, we measure that. Creatinine is like the byproduct of all the muscle breakdown and the way your kidneys filtrate. And if it comes back 0.0 creatinine, that's tap water, guys. That don't work. So that's an immediate red flag, and you have some explaining to do. But usually that's a very, very lazy effort. And so, sorry, you got to go. Not to be just grouped in with what we call the scraper. The scraper is someone who is trying to contaminate a specimen by using tap water only. And then it adds a level of difficulty where they take a little bit of their pain pill and crush it up and actually sprinkle it in the sample. No. It doesn't work like that. Basically, when a specimen will come back, the metabolite, the parent drug will be off the chart because remember, we're dealing with 1 billionth of grams. You're going to have 10 times what you expect to be in there and 0 metabolite because it's not gone through the body and it's not been metabolized. So with that, we give it a 1 out of 4 effort, level of difficulty. Not gonna fly. And plus your creatinine is still 0, okay? So, moving on. Number 3, urine drug screen is positive for another opioid. And you talk to the patient, hey, we prescribe XYZ, your urine sample, there's a problem, it's positive for ABC, a different type of opioid. And their response is they blame their significant other. This happens a lot. They will throw their significant other under the bus by way of, I just take what my wife gives me. What? You're like a baby bird that sits there with their mouth open and your wife comes by and drops a pill in your mouth? No. Sorry, guy. That is really, really bad. Blaming the significant other, that's going to get you fired. Sorry, we can't help you. Blaming the significant other and playing the helpless victim card doesn't fly. And for that, we give you a -2 out of 4. We get you lower than the 0 out of 4. It's just not good to blame the significant other. If you have a problem, talk to us. We can help you, man. Moving on. Number 2 on the top 4 UDS fails. Urine drug screen is positive for THC. THC is the active component of marijuana use. That's what everybody's testing for. And they deny using it themselves. And I was around people smoking it, but I didn't do it. Now, we're talking about in states that marijuana use is still illegal for personal use and they don't have a medical prescription for it. Okay, I don't want to get comments for that. But what they tell you is, look, I didn't smoke it. I don't know, I was at a party Friday night, and it's Monday morning, by the way, and when they submitted the sample, and I was around a bunch of people that smoked. Now, that is extremely unlikely. And I'll tell you what. There's research shows that they tested this, okay, and the way they tested this under extreme conditions. And their extreme conditions were put a non-smoker and a smoker in a 10 by 13 acrylic box, sealed box, and gave the smoker 10 joints to smoke in an hour. What? 10, anyway. And so they tested the non-smoker at 2 hours and 22 hours later. Now, one out of the non-smoker group that they tested did have a small amount that would be positive on a qualitative urine drug screen, okay? It would show a very small amount. Now, what that would happen is when you send it over to the quantitative, it would show an extremely small amount if that was the case, okay? What's gonna be the reality is their THC level is gonna be high. You're gonna send it off to quantitative and it's gonna be way higher than the baseline, and it just doesn't match up with the story. So with that, we give it a 0.5 out of 4. Just not believable, guys, sorry. So we come to number 1 on the top 4 epic urine drug screen fails. And this is, and you'll see it everywhere. The urine drug screen is positive for methamphetamines, amphetamines the parent drug, and the metabolite, MDMA, okay? But they deny using it. They don't do methamphetamines. They don't know how it got in there. And after you talk to them a little bit longer, they say, okay, well, I didn't want to tell you, but. If you hear a but, it's coming. My boyfriend uses methamphetamines daily. And we had intercourse the night before I came in, and you did a urine drug screen on me. Now, if your significant other is recreationally using illegal drugs, that ain't a good sign. Numero 1. Number 2 is They don't work like that. And I'll tell you why. Now, there are some studies, and I don't know how they did it. It was animal studies, and I'm glad I did, and I never had to be selected for those type of studies. But they tested at animals that very, very, very small amounts of some illegal drugs have been found in male semen specimens of animals. Okay? I'm just going to leave that there. But even so, that such a small amount would ever be transmitted to the partner to the point where it would show positive on a test at any time. It's not going to happen, guys. Okay? It's just not going to happen. So, and actually that fail is actually a combo of number 2, somebody else was doing it, I'm innocent, and number 3, helpless victim. So actually, it's a combo of the 2 and 3. So with that, we give them a level of difficulty of like 1 out of 4. Okay? So I hope you like this. We're just trying to do something different. We're not making fun of anybody at all. We come across people that have problems all the time. We help them, okay? Urine drug screens pick up a lot of things that patients are afraid to tell us, and we're all about helping people, okay? And you'll see these all over the internet, and we're just trying to help people, and in the end, get them to the place that they can get the best help. So if you have another fail that you've come across, put it in the comments, okay? If you want to see more stuff like this, put it in the comments. If you like what we're doing, give us a like. We like likes. And if you really like us, I hope you subscribe, keep up with other stuff we're bringing out. We enjoyed doing this. It's something different, and look forward to seeing y'all again. All right? Have a good night.